More infections sparks fears of new global spread. Toddler 2 dies from rare virus. And the recent surge in prevalence of this illness initiates mask wearing requirements and mandated declaration for all of these people who are now at high risk and who have just been put on high alert. Plus, 15 states seeing high or very high levels of respiratory illness. Warnings have just been released by health officials, and these are some very important alerts breaking right now that we should all be paying very close attention to. Now, I know that this isn't the news that anyone wants to hear right now, that right before Christmas, the United States and the whole world for that matter is being told to stay indoors, wear protective face coverings, and of course, jab up. But my opinion is that knowledge is key. And if you want the latest and most up-to-date and accurate breaking news to stay safe and be prepared, then make sure you're subscribed. And while you're at it, hit the like button. It takes just a second. Now, the numbers are still rolling in, but in total, these 15 states plus New York City are experiencing high or very high levels of respiratory illness activity, as defined as people going to the doctor with symptoms from any respiratory diseases, including flu, Rona, RSV, and the common cold. And I have a map that I'm going to put on the screen for you guys. And this map shows the level of respiratory illness activity all across the US. And you can see which parts of the country are experiencing it the worst, and the parts of America that will be labeled the hot zones. And from what I've collected here by doing my own independent research is that the CDC is actively tracking a rising variant known as JN1, which they say is a descendant of the BA.286 Omicron subvariant. And this was according to an update posted by the federal agency less than 24 hours ago. So currently, JN1 makes up an estimated 21% of cases, and scientists believe it may be more transmissible due to its continued growth. Meanwhile, flu activity continues to increase, with the southeast and south central areas of the U.S. reporting the highest levels of activity according to the CDC. And modeling from the Federal Health Agency estimates infections are growing in 34 states, while declining or likely declining in one state and stable or uncertain in 4 states. Plus, hospitalizations are also increasing, an increase of over 4,000 from the previous week's data. And if you haven't seen my last video about the coming collapse of the healthcare system right here in America, then I highly encourage you to watch it next, because you're not want to go without knowing what's happening and being best educated on how to get ready, stay ready, and be prepared. And so from the looks of this map, the states that are ranking at high or very high levels of RSV include California, Nevada, Arizona, New Mexico, Colorado, Wyoming, Texas, Louisiana, Arkansas, North Dakota, Indiana, Alabama, Mississippi, Tennessee, Georgia, South Carolina, North Carolina, Florida, New Jersey, and of course, NYC. Now, this data is being updated daily, so be sure to check back for the latest and turn on your alerts and notifications so that you're pushed a message from YouTube as soon as my next video is released with all the new updates. And drop a comment. Let me know, what states do you live in so that I can get a better gauge of where to keep an eye out for news that will impact and affect the majority of subscribers to the channel. And if you aren't in the States, please just let me know what country that you would like more information on. Okay, thanks. And now, Forbes has come out with this alarming report that I will share on the screen so you all can see. More infectious mpox sparks fears of new global spread. And here's what they're saying that we need to know about the deadly virus. But just full disclosure and a bit of forewarning in my attempt for full transparency, I have to be very careful and cautious about how I tiptoe around some of this information and terminology for obvious reasons, because of where we are and how this platform dictates how limited our access to information, education, knowledge, and most importantly, the truth is getting worse each and every day. For more, the full story, honest opinion, and zero censorship, I have a link down in the description to Patreon, or if you just want to show some love and help support the intense amount of time and effort that goes into producing these videos for everyone, then I would greatly appreciate it. No pressure, and thank you all for your continued support. So let's see here. The Centers for Disease Control and Prevention, the CDC, has issued a warning here in the United States to clinicians and health officials about a lethal strain of Mpox spreading in the Democratic Republic of the Congo, or the DRC. They say that this strain, known as Clade 1, is causing the largest ever Mpox outbreak in the DRC and is more severe, deadly, and infectious than the Clade 2 variant that led to a global outbreak in 2022 and earlier this year. Currently, Clade 1 has a fatality rate of around 10% or a survival rate of 90%, however you want to look at it, when compared to less than 1% for Clade 2. And unlike previous outbreaks primarily linked to animal contact, the current Clade outbreak is being transmitted through a, let's just say, more intimate means of interaction, okay? So by way of sexual contact, it has been determined that this was a major transmission route in the global outbreak, affecting mainly gay, bisexual men, and other men who have sex with men. But the CDC has urged U.S. clinicians to be vigilant for Mpox cases among travelers from the DRC and to test patients showing symptoms. They have also issued travel advisories for the DRC, advising avoidance of contact with sick people, wild animals, and consumption of game meat, especially with the rise of CWD all across the country now. And the World Health Organization, the WHO, has expressed concern about the spread of this outbreak and its potential adaptation for increased human-to-human transmission. The WHO is particularly worried about an outbreak amongst sex workers in the South Kivu province due to their vulnerability and the risk of spreading the infection to nearby countries. So, passport bros, beware. And in the U.S., the CDC has recommended notification of state health departments for any suspected cases linked to DRC travel and quick submission of specimens to identify the clade responsible. Clade 1 has not been detected in the U.S. before, and they have made reference to countermeasures for Clade 2, including jabs, or the V word, antivirals, and antibody therapy are all expected to be effective against Clade 1. But this is not medical or healthcare related advice. This is just a synopsis and summary from the research that I've done and the information I have collected through various sources tied to the CDC and as reported and shared publicly on Forbes' website. Although there's a lack of firm clinical data, the CDC notes that overall jab coverage in the U.S. remains low, with only a quarter of eligible individuals having received both doses of the available Jynneos Mpox offering. Meanwhile, the global spread of Mpox in 2022 was unexpected. And again, these are their words, not mine. Not mine, guys. Now, as it had previously been confined to certain regions in Africa with limited outbreaks, the viral illness related to smallpox typically spreads through close contact and is less severe than smallpox. And as of this year, there have been 12,569 suspected Mpox cases in the DRC, which is a significant increase from the previous year. There have also been nearly 600 deaths in the DRC, which works out to be about 5% of the suspected cases. And globally, there have been 92,167 Mpox cases since 2022, with over 31,000 cases right here in the US and 170 deaths worldwide. And lastly, despite the ongoing global circulation, many health agencies, including the WHO, have rescinded emergency warnings for Mpox. And I will reserve my opinions on that last bit and just patiently await the opportunity to read your opinions on this move by the WHO that you can leave down in the comment section below. Now, let's move on over to NYC and the latest epidemic and warnings coming out of the city under Governor Kathy Hochul's command, breaking official declaration and new mask wearing requirements. And Dr. James McDonald, the New York State Health Commissioner, has declared that the flu is now prevalent in the state. And according to the Post, this declaration triggers a requirement for unvaccinated healthcare workers in various healthcare facilities to wear surgical or procedural masks. The affected facilities include hospitals, nursing homes, diagnostic and treatment centers, home health agencies, hospices, and more. But I got to tell you guys, I wonder if, or better yet, maybe when, this declaration will be extended to all of New York City. And honestly, I can't put anything past these folks in office with the latest that includes some of the wildest and craziest, most shocking and unthinkable things to be proposed, voted on, and passed, signed into legislation, like New York ban on guns. New York City approves new measures for citywide noise cameras, a ban on parking, and this one here really made me laugh, folks. A $15 congestion tax for sitting in world famous New York City traffic. I mean, come on, guys. You really can't even make this stuff up anymore. And I stand by my original statement. I'm glad we got out of there when we did. Nevertheless, this New York City enforced mask mandate decision follows a significant increase in lab-confirmed flu cases. And they said that in the area outside New York City, cases have risen by 34% from 1,487 to 1,993. And within New York City, cases are up 21% from 1,713 to 2,068. Meanwhile, Dr. McDonald also emphasized that unjabbed healthcare professionals must wear masks in healthcare settings to protect vulnerable patients from the flu. And he also recommended that everyone aged 6 months and older get the flu shot, which he says is the most effective way to prevent infection and reduce the severity of the illness if contracted. Additionally, they mention how the flu shot is particularly important for those at high risk of hospitalization, including people 65 years and older, those with certain chronic medical conditions, young children, and pregnant women, and how a high-dose flu shot is advised for those 65 years and older. But again, folks, this isn't medical advice or healthcare tips. I'm only just sharing with you what was included in the latest news reports. And they did go on to include even more information in regard to treating the flu and talks about how antiviral medications like Tamiflu can be prescribed, which they say help in reducing the duration and severity of the illness, and how the state has also received permission to access the strategic national stockpile for Tamiflu to address any shortages, but there has been no mention of pricing or potential increase or inflation of pricing for these meds. Now, I know that was a lot, and we covered a ton of information in this one. So if you need to, go back, watch the video again, drill down on the latest breaking. And as always, if you want to, feel free, reach out. Now, this is not information designed to instill fear or induce panic, because I know that right now, a lot of people are extremely worried and experiencing high levels of anxiety based on all that's happening around us. And unfortunately, a lot of folks don't have anybody to talk to. So please believe me when I tell you that this is not in any way an attempt to monger fear or instigate and or exaggerate alarm based on what's happening right now, what's happening all around us, that you can just walk outside and look and see for yourself. Now, I just want you all to stay safe, in the know, and have access to the truth. Be ready, willing, and able, and do my part to help as many people as possible with the little bit of reach that I have right now through these YouTube videos. Now, thank you all for your love, understanding, and unbelievable amounts of support. It really means a lot to me. And until next time, stay safe, stay smart, and stay frosty, friends. These are the warning signs that we've been talking about all along. So watch your six and look out for your family, your friends, and your neighbors. Now, I'm going to go ahead and get back to work, and I hope to be able to bring you guys another valuable and informative video. So stay tuned. Have a blessed day, and I look forward to seeing you all again real soon.
I can tell you my problems, meditating my silence, but I keep pushing my pen, rotating my stylus. Brokenness feeling like sin, now no breath, low dollar. Used to be left on red, now all the girls go holler. Now all the girls go follow, all the fake friends gon' pop.